Globally, expectant mothers face a silent yet deadly threat after childbirth, known as postpartum hemorrhage, PPH, a condition characterized by excessive blood loss after childbirth. Responsible for nearly 30% of maternal deaths, this crisis affects sub-Saharan Africa the most, where maternal mortality is approximately 500 to 1,000 per 100,000 births, with postpartum hemorrhage responsible for 30 to 50% of the deaths in the region, according to data published in the United States Library of Medicine. In response to this urgent challenge, the Africa Center of Excellence for Population Health and Policy, ACEPHAP, located in northern Nigeria, launched the emotive trial.
We realize a lot of research are done, but nobody really implements what the research findings are. So we wanted to go one step ahead, which means we'll do research and we will translate our research findings to policy and to implementation. And that is why we're called African Center of Excellence for Population Health and Policy. So all our students are taught how, when they do a research, find a problem within their society, then the findings should be able to influence policy or influence implementation so that we can have a feedback into the community.
This groundbreaking initiative focuses on the early detection of PPH and rapid treatment through the World Health Organization's First Response Emotive Bundle.
We looked at SDG 3, and SDG 3 looks at maternal health, child health, non-communicable diseases, communicable diseases, mental health, and nutrition. So actually, ACEPHAP is a combination of all these experts in this thematic area. So we're trying to make sure that we influence and change the narrative and make sure that we are able to achieve SDG 3.
Funded by the World Bank, the Africa Center of Excellence for Population Health and Policy, ACEPHAP, was established in 2019 to strengthen interdisciplinary approaches that promote population health outcomes through training and research, ultimately supporting evidence-based policy development in West Africa. ACEPHAP's mission is to develop a skilled workforce in population health and ensuring that research directly informs policy development, paving the way for sustainable health advancements.
Under one of our DLI, which is DLI 5.3, we actually invited people to come and pitch on their different innovations. And we had young people that had excellent ideas. And out of them, we're able to give more money to some of them to improve what they have done so that they can get it to the level of a patent. One of them is actually using fingerprint to diagnose breast cancer. And she has gone from PhD. Now, in fact, they're giving her postdoc in the US without even her finishing her PhD. People are already calling for her. So she's one of the people that we're supporting to make sure she gets to the next level. And we have we actually gave 3 of them, we gave them prizes. And then for the remaining 10 of them, we also support them so that they can actually register their company and make sure that they have a patent.
To further combat maternal mortality, ACEPHAP has trained over 1,200 healthcare professionals and implemented the World Health Organization's postpartum hemorrhage prevention and treatment guidelines in 40 health facilities across Nigeria.
The difference we've seen from the normal thing we do in the emotive trial is that the emotive involves early detection. So because we use this drape which measures the blood loss, initially we just use visual inspection. You just use what you see. We don't have something to measure the blood loss. So we now have a drape that can measure precisely the blood loss. So it will give us a warning when it's at something like 350 mils, and when it's at 500 mils, for sure there's postpartum hemorrhage in the patient. So we add this together with other clinical symptoms for early detection of postpartum hemorrhage.
All the hospitals, the 40 hospitals where we trained them and did the emotive research, every single one of them did not want to stop after the research because they said they no more see a woman dying from bleeding. People that see women dying every month from bleeding. Now go through a whole month, nobody dying from PPH.
Prioritizing policy development and implementation, ACEPHAP works closely with local government entities and village leaders to gain support for its community engagement projects. This foundational approval is crucial for effective program execution.
We've had a lot of community engagement. A lot of them came through our researches, the different research that we do.
ACEPHAP has engaged in numerous community activities to identify pressing health issues and design targeted interventions.
There's a day that I take my child to immunization. So on entering the hospital, I just saw the midwives there running up and down, trying to refer a patient to a higher facility.
And then she now approached them. In fact, she was afraid to approach them because she doesn't work there. But she said she knew something that could save them. And therefore she approached them and said, you know what? I have a training that I can save this woman that is bleeding. And they said, please go ahead. And then she came and did the bundle treatment. And the woman stopped bleeding. It was like a magic.
She controlled the bleeding and trained us how to control the PPH.
We are so happy that she helped us in bringing the emotive package. We wish to have more and more training about it, as it will help us in advancing our work and services here. The package is the more and more training and everything about the emotive. We will appreciate it.
I myself know that I try saving a life because I believe with this emotive bundle, no woman should die of PPH. I repeat, no woman should die of PPH because it really do wonders.
For her, this is the greatest thing she has done in her life. And she's so passionate about it, and she's so thankful to ACEPHAP and to Emotive.
Collaborating with various organizations, the center has facilitated programs such as providing injectable iron to pregnant women, offering breast cancer screenings, cervical screenings, and dental services, all at no cost.
The health outcome for pregnant women, we are hoping to change the story for northern Nigeria. But so far from those community engagements and the outreaches that we've done, I would say well over 3,000 young people. I remember there was one we also did on menstrual hygiene for young people. They had hundreds of young girls coming, benefiting from sanitary pads and other hygienic products that they could use during their period.
Discoveries of the center has saved lives. The practice of delivery, around Kano, many lives, according to what they have given, about 60% of life have been saved from what they have been able to discover and then release for people to use.
I had a lot of feedback as well. For example, the emotive trial, when we did it, the impact on maternal mortality was huge. And people came back to tell us that because of so and so that was done, they were able to save the lives of their women, and they're happy about that. The same with the Ivon trial that I said in the community, pregnant women are doing better because they are getting injectable iron. So we have people in the community testifying that, look, because of this trial, our women are better, we can do, we can see the outcome already, that this research about injectable iron, the women are better, the children that they are delivering are also better.
Collaboration is key to ACEPHAP's success as it partners with diverse academic and sectoral institutions.
Presently, the MBS itself is partnering with ACEPHAP under the same present project that is going on, which happens to be for child mortality, the death rate between the female folks during childbirth and stillbirth. We have so many things lined up, which they said they have some projects at hand, but the moment they secure them, they will want us to come and sit with them. Let us see what we can do together. In terms of the mapping itself, since we are experts in terms of that, I think it's something that we can do together with them.
Another project that we're working on is called the e-Dokita, that is going to have like mobile clinics, particularly as regards maternal health.
We have a collaboration with the ACEPHAP. What we do is we're looking at the primary health centers and then trying to digitize some of the processes so that they can be able, people in the remote areas can be able to access healthcare from the cities.
At the sectoral level, the center's partnerships extend to the Kenya Medical Research Institute, KEMRI, Chatham House in the UK, Lighthouse in Nigeria, and various other organizations.
We have a molecular sequencing lab which came about as a result of our collaboration with one of the ACE centers, particularly WAGBIP in Ghana, which is based in University of Ghana. And we got this and they supported us with not just the machines but also capacity training.
I have been collaborating with them in issue of what is called IBON trial, which is a trial to see introducing intravenous iron, whether it's more important than giving oral iron tablet to pregnant women.
Academic collaborators include Dan Colado University in Niger, Tanta University in Cairo, the University of Cambridge in the UK, and Vanderbilt University in the USA. The center offers demand-driven PhD and master's programs.
The center has 5 master's programs and 2 PhD programs,
including Embassy in Maternal and Child Health and Policy, Public Mental Health and Policy, Global Health and Policy, Public Health Nursing and Policy, and Public Health Nutrition and Policy.
1/3 of our students are also of female gender, reflecting the guidelines from the ACE program.
The center attracts international students primarily from countries such as Ghana, Liberia, Sierra Leone, Kenya, the Democratic Republic of the Congo, and Cameroon.
There is a scholarship program for regional students. So the scholarship program covers, one, it covers the tuition fee for the programs. It also covers for the fare.
The amazing part of it is that it's a scholarship. It's something I couldn't really do back home without spending so much money. Yeah, it entails a lot of money, and yeah, I am studying it for free. It's a huge benefit for me. And you know, the people are so amazing, yeah. And then not just that, I'm given an allowance that sustains me, you know, leaving your home country, leaving your family, coming to a land where I can say this is my first time coming here, and it's because of this program I came. But they have really been a family to me, yeah. And they have been sustaining me, you know, a lot of benefit. I can't really count them all.
The scholarship covers health insurance coverage in the event of ill health or infirmity during the stay.
I had some other master's program before I enrolled in this, and I have seen the difference. It's really clear.
The center pays for support for the internship program, whether it's done in Nigeria or outside Nigeria.
There's one thing peculiar about this center. When you are doing your MSc or PhD, you have to undergo one month internship. That 1 month internship, it helped a lot in improving our capacity, especially in terms of management, as well as the best approach for planning and for planning a program.
As a national student, one of the benefits is, you know, apart from the MSc program the center is having, there are a lot of researches and clinical trials they are on. So I was opportune to be selected as one of those to participate in one of their clinical trials. And I am the deputy project coordinator of that trial, which is STEPMAG, Simplified Treatment of Eclampsia using magnesium sulfate. So this is one of the benefits I had from the center. I have never had a benefit of being part of a clinical trial.
In addition, ACEPHAP provides specialized short courses in grant writing and research methodology, curriculum development, infectious disease surveillance, community management of acute malnutrition, and translating research findings into policy. The center has produced over 200 publications in national, regional, and international journals, contributing significantly to the body of knowledge in population health.
One of the ways that the center is going to sustain itself is through grants, because we have established ourselves as, you know, an institute that does high impact grants. We intend to be going all over to do trainings on grant writing, because people see that we are able to get grants, so how do we do it? So we teach people how they can get grants. We feel training will be another method of getting money. And then patents. We're trying to do e-health, and once we get it, it's an app. And then once we lodge it, then you have to pay before you can get the app and to use it. So we're going to patent that. So that's another one, patenting. And then consultancy. We feel we can have consultancy, people can access for consultancy, and that's part of also getting money.
We make sure that they continue to develop programs that will be attractive to interested people, and then the university will facilitate access to other sources of funding like African Development Bank and other sources of funding. So we are going to continue with that.
With this stage that we've set for ourselves, people look for us. In fact, we don't compete for grants nowadays. People get us and say, can you come and work with us for this grant or that grant?
I 100% recommend people to come and join this center because they have a good program, and also the lecturers there, they are very accommodative, and they are always ready to help the student. When you have a problem, you can directly go to the lecturer to tell them, this is what I want and I don't understand this aspect. The lecturer will take a time to explain everything in a detail. And also the center, they have an accountability mechanism whereby they will always, they are engaging with the student. They are asking the student, which area do you want us to improve, or which program or which direction do you want us to do more on it, and something like that.
Mental health is a very beautiful field, and I would really like to recommend it to so many people, you know, especially if you want to really create an impact, you know, in your area, in your sphere of influence, in your country, back home. I think you should come for this program. It's really amazing.
Well, my recommendation is you should come and be part of African Center of Excellence for Population Health and Policy. There are a lot of opportunities. Apart from the qualitative MSc degree that you will have, I'm telling you there are a lot of opportunities.